Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us. I'm going to have a conversation with Dr. Glenn Copland, founder, chairman, and CEO of Copeland Biosciences. And he's joining us here on the program to talk about his company's focus on nanotechnology to administer CBD in the treatment of sports injuries. Welcome to the program, Dr. Glenn Copland.
Thank you, Neil. Thanks. It's a pleasure to be here.
Now, what is your medical background? I mean, we're talking about sports injuries. Are you a chiropractor? Are you an orthopedic surgeon?
By training, I'm a sports medicine podiatrist.
Okay.
But as an administrator, I'm a medical director of a number of different teams and oversee the, if you will, director of medical services.
Now, I mentioned, of course, Copeland Biosciences' focus on nanotechnology when it comes to CBD. First of all, how did you first become interested in CBD therapies, and how does nanotechnology, lend itself to sports medicine and CBD?
Well, it's an interesting point. Most sports medicine docs who are involved, either at the amateur or professional level, we learn an awful lot from our patients. And in Canada, when marijuana was legalized for medical use about 5-6 years ago, it became very apparent that patients, not so much doctors, because the medical community never has, openly embraced marijuana, CBD, or any of the derivatives, but players did, and all we had to really do was listen to some of the results that the players were coming in with, and we really looked at the topical application as opposed to oral and ingesting, and we started seeing a real trend that the players, guys and girls, who were using CBD oil topically were getting significant results. And as a result, I took a real interest because I've always had a slant on the topical treatments, whether we're using sound waves or laser, shock waves. But CBD interested me because of the number one, the safety that was being written up in the literature, and the actual results we were seeing in front of us with these players. So we started looking at the topical applications and started clinically trying to figure out the best way to get CBD through the skin and into an area where it would do the most good. And that's sort of been the push over the last number of years.
Now, topically, of course, we're talking about maybe a cream, an oil, a salve, something like that, as opposed to, vaping CBD in certain amounts or ingesting it, let's say, in gummies, things of that nature. Why wouldn't a topical ointment or a cream work the same as, say, a Bengay or something?
Well, it's a great question. So the vast majority of these topical applications are not driven through the skin. The skin is an incredibly tough membrane to try and get anything through. That's where our technology has been the leader, and that is that. I mean, think of it in these terms, Neil. If the skin was so easy to get through, every virus, which is a nano size, and every bacteria would easily get through, and everybody be walking around with viral infections and bacterial infections. Well, the skin is such a great membrane; it keeps all of that out. So when you start talking about, the local topicals that you can buy in the local drugstore, the vast majority of that stuff never gets through the skin. What we specialized in was literally looking at, and you can call it nanotechnology, we can call it any part of driving the topicals through the skin, but by using either sound waves, laser wave, which is a light wave, and or pharmaceutical, we were able to come up with formulations where the vast majority of our technology, of our formulations, actually gets driven through the skin. And that's what's really proved the most effective. And we work very closely with, what we consider to be the world authority on inflammation, a gentleman by the name of Dr. Mark Feldman. Dr. Feldman is actually Sir Mark Feldman. He is the inventor of Remicade, one of the greatest anti-inflammatory biologicals that first came out. So working with Dr. Mark and our team, we've been able to do topically what Dr. Mark was able to do in helping, treat things such as rheumatoid arthritis and Crohn's disease and colitis and all the autoimmune issues. And so that's the difference. It's getting the right formulation and then getting it to where it's going to be best used, which is through the skin.
What new application technology specifically is Copland Biosciences using? And talk about these results. That's my first question is you mentioned the laser, you mentioned sound waves.
Yeah, one of the newest technologies is there's about 3 or 4 pharma products that literally we've known for years can help drive certain medications through the skin. There's a product that's been around for about 40, 50 years, DMSO, but the new one, Pluronic lecithin organogel, PLO, is one of the newest ones, and we have found a super way of using the PLO in the right mixture, right formulation to carry the anti-inflammatory medications through the skin using certain acoustic waves, which is a sound wave, or a light source, which is a laser wave. So it's a combination of the 3 or 4 things, and then how you formulate it is a significant factor in how much you can get through the skin. And so people, for argument's sake, with tennis elbow, golfer's elbow, certain shoulder issues, plantar fasciitis, Achilles tendonitis, so many of these illnesses and sports injuries, which we used to treat with oral anti-inflammatories, some of them even with opioids, we can absolutely, get to these areas with almost, virtually no side effects and long-term relief.
You mentioned early on that you were getting a lot of information, a lot of positive feedback from players, not necessarily the team, the management, the league.
Right.
In Canada, with things being legal as they are now, I'm going to assume that working with CBD as far as it relates with sports leagues themselves and their policies is a bit, I guess, less of a Shark Tank. But here in the United States, how do you think things will be affected here in the United States as far as CBD with the medical community, as you said in the beginning, not embracing CBD and marijuana?
Right. I think first and foremost, I don't think there's any sports medicine group who's embraced CBD, and rightfully so. There's not enough research. There's not enough studying. There's not enough clinical papers. You can't just anecdotally stand up and start saying, CBD works. This is 2019. So, the companies, pharmas are going to have to produce great clinical research to support the claims that the players are feeling. I mean, when I got into this, it was the players coming to me saying, "Hey, I use this stuff and I'm getting better really fast, much better than anything else." And so when you start to see those anecdotal results, it's great. But our little company is going to set out now to put together research protocols with Sir Mark Feldman to once and for all, get down to the root of what are the benefits, what are the risks, where is it indicated, how do we go about doing it? In the meantime, because CBD in Canada is legal, is for medical use for sure, and probably it's another 4 months away before we know what the recreational side will lead. You follow the rules, you make sure that you're using it appropriately, and you're doing your follow-up properly. And I've got to say that I think once the medical clinical studies are in place, I think then you'll get the major sports leagues across the U.S. to look at it and to come up with a smart and a responsible approach to dealing with all the different medications. I think the one thing which we can, all agree on is that we want everybody away from opioids as quickly as possible. And
Absolutely.
We're looking for the alternatives. And I, on a personal level, I absolutely have seen enough anecdotal results that make me believe that the CBD is a much safer product than the opioids, and gives us a great opportunity to study them in depth and to find out what the real benefits, are going to be down the road.
Where can we go and learn some more information about Copland Biosciences?
We have our great website, CoplandBiosciences.com, and we update it on a very, very regular basis. We're very active in moving our stuff forward, and so by all means, please visit the website. We'll keep you up to date, and we look forward to bringing some great research down the road very quickly.
Great. Thank you, Dr. Copland. That's CoplandBio.com.
Yeah, thanks a million. Appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of the program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.